In digestion, food is changed by the organs into a soluble form to be absorbed by the body. Food in the mouth is mixed with saliva. Saliva begins to dissolve the food as the teeth grind and cut it. Food is forced back into the throat, pharynx, by the tongue. Food in the pharynx stimulates the swallowing reflex. The larynx is pulled upward to meet the epiglottis and seal off the trachea. Food goes from the pharynx to the esophagus. Food moves down the esophagus by peristalsis. The peristaltic wave reaches the esophageal sphincter and food enters the stomach. The unique muscular structure of the stomach breaks up the food into small pieces called chyme. Chyme exits through the pyloric sphincter into the duodenum of the small intestine. The major portion of absorption and digestion occurs in the small intestine. The mucosa secrete enzymes that supplement the digestive enzymes of the pancreas and liver. This completes the chemical process of digestion. The walls are covered with villi where nutrient absorption takes place. The structure of each villus contains a capillary and lacteal to pick up the digested nutrients. The nutrients are now transported by the blood to all the cells of the body. The undigested food reaches the ileocecal valve and enters the large intestine or colon. The colon absorbs water, manufactures vitamins, produces mucus, and forms and expels feces. Mass peristalsis pushes the feces into the rectum, which stimulates the defecation reflex.
Hi, I'm Dr. Kenneth Levine. Welcome back to Health Talk. I remember years ago I saw a patient who I've been seeing for years and who was healthy in their mouth, and all of a sudden his mouth changed. I said to him, what's going on differently in your life? He said, well, my stress level has changed. I said, well, what happened? He said, well, I used to be a teacher. I worked from 9 to 5 and everything was fine. I had 3 months off in the summer. Now I'm a commissioned salesman and my life is a lot different. There's a lot more stress. And I knew it by looking in his mouth. Things were changed. So let's talk a little bit about stress and how that affects the body.
We're learning that stress and the stress hormones, which are growth hormone, cortisol, some of the other hormones, adrenaline, a high level of stress hormones, we are learning affect the immune system in ways that are not yet clear. But constant stress affects our ability to fight infection, our ability to heal, and stress makes many of the symptoms that we feel more severe. Let me give you an example. And I use this all the time with my patients. Let's say you're in a good mood, you just come back from a party, you're meeting a lot of people, you had a couple of drinks, everything is good, you feel great, you stub your toe. It's no big deal. But now you had a really crappy day at work. You got caught in a traffic jam on the way home, you had a fight with your boss, you have a headache, everything is going wrong, and you stub your toe. In the second situation, that toe is going to bother you a lot more. So the frame of mind that a person has changes that person's perception of their pain. So that a person has abdominal pain, irritable bowel, that person's in a good mood, everything is going well, their kids are doing fine, the marriage is going nicely, the symptoms quiet down. All of a sudden, marital problems, financial problems, the kids are sick, more issues, all of a sudden those mild symptoms that the person is feeling becomes that much more dramatic and interferes that much more with a person's life. Often the primary care physician or the specialist, could be cardiologist, gastroenterologist, pulmonologist, some of the specialists, if they are comfortable dealing with the emotional part, the patients look for them to do so that they can say, Doc, you can take care of me. I've heard that many times. I say, I think you should go to a psychologist. I think we need help. Say, you know what, Dr. Soff, you can take care of me. I have confidence in you. It's flattering to hear, and we will go out of our way to counsel them, talk to them, reassure these people, and use medications.
I know it takes a lot of time because these medications many times have to be titrated to the specific patient at a specific time. Is that right?
It does require patience on the part of the patients as well as the physician, because to find the right dose to find the right combination of medicine does take some trial and error. It does take some monitoring, and the patient physician really need to work together and communicate well to find the right doses of medications.
Got it. So, you know what? We're going to talk a little bit more about gastroenterology in a moment, and you can give me some specifics about that fascinating field. I'm Dr. Kenny Levine. We'll see you in a minute on Health Talk. Thank you.